it's very important to me that we're not just looking for, do you have a disease state, but is your body functioning optimally? And those are really two different approaches to have. It's like even insurance coverage. Well, we're not going to cover any treatments until you get bad enough. Well, to me, that just seems so backwards, right? Why would we wait for the wheels to fall off, you know, before we do anything about it? So it's this downstream thinking in the sick care kind of where the backward incentives are just backwards. So help care is the antithesis to that.
Welcome to Take Charge with HELPcare. I'm Lee Aase, your host, along with Dan Hinmon, my co-host. And today we're delighted to welcome to the Take Charge with HELPcare microphones, Sara Persinger, who's one of our newest nurse practitioners. She just started with us in January and is getting off to a great start, is working in both Albert Lea and in Rochester. And so, Sara, we're glad to have you join us today.
Yeah, thank you so much. Well, I'm thrilled to be here. I'm thrilled to be a part of healthcare. I just couldn't imagine this all coming. This is like the ideal dream job to really be able to practice in a way that feels ethically genuine, with everything that's important to me. I get the opportunity to really have that approach with patients. So it's a dream come true. So thank you.
Well, we're all about making dreams come true. So so this is great, and it's just a delight for us to have you with us because I think we recognize from the when we first talked that you were very much aligned with what we're all about. We're delighted to have our patients get to work with you, but then also to take this time now to have the broader community get to know you a little bit better, so that they'll want to come see you.
So we're excited to hear more about dreams and what they are and how they've come true. But start by telling us a little bit about your background. Where did you grow up? How about your education? Anything you want to share about your family?
Well, I grew up on a dairy farm in northwestern Wisconsin and loved that experience growing up with very little technology, and playing out in the woods, making forts and working hard, picking rock and, working on the farm. My path to nursing was sort of a winding, twisting road, actually. It wasn't very straightforward. I had my first experience in healthcare as a CNA. That was one of my first jobs. I worked in long-term care as a certified nursing assistant, and I loved that setting. And then my life kind of took some detours. I actually had some personal problems with addiction. And in my early 20s, I was really struggling with mental health. I couldn't finish school. I was dropped out of college. I had a lot of problems and was able to kind of come through that very difficult time in my life through a program that really helped me address all these issues. And that's really where my faith became much more real to me, too. It's a very important part of my life, my backstory. But because I was having these difficulties, I wasn't really in a place where I was able to pursue a professional career until I was about the age of 30. I had pursued Christian ministry. So I have a bachelor's degree from Northwestern College in Christian ministry. And I was doing that. I was working in a ministerial setting, but I really felt like I'm missing the science. I always loved science. I loved understanding the human body, anatomy, and physiology. And I got to a point when I was 30, I really felt like I want to have a career that I can take anywhere and everywhere. I want to be mobile with what I can do. And I want to be able to provide a service that's really useful for people. I want to help people. So I really thought, it made sense. I had a little experience in nursing with my CNA background. Maybe nursing is the route to go. And so I did. I went back to school. I pursued my bachelor's degree from the University of Eau Claire in nursing. I got my BSN degree. And then I found myself in Rochester, Minnesota with Mayo Clinic. And so that's how I kind of got my nursing start. And I worked at a general medicine unit that was taking care of people that were at the very end stage of really what I would call lifestyle disease, right? So chronic kidney disease, liver disease, diabetes, obesity, all of these things. And I loved taking care of patients at the hospital and the bedside. That was very precious to me to be able to be caring for people at that point in their life. But I also was getting frustrated because I was noticing something could be done to prevent patients from getting to this point, and so that's really where I became passionate about primary care. And I thought, I don't want to just meet people here. I want to journey with them through their life so I can just continue to coach and be cheering for them and hopefully improving their health, right? So that they don't have to end up in the end stage of a disease process. And that's when I decided to go back and pursue my graduate degree from Winona State University, as I did their family nurse practitioner program and the doctor of nursing practice degree. And that was a wonderful experience. I did a nurse practitioner residency program at Mayo, had in family medicine, and had a wonderful experience then. And then my career my first job I actually had was kind of coming back full circle into addiction medicine. So I actually went right into a specialty. And of course, I have a heart and a passion for people struggling with addiction. And so that made a lot of sense to me. And I was able to utilize some of my background in ministerial settings and life transformation to kind of help folks in that realm. And then, I was just happy to finally find a home in family medicine doing primary care, which is what I set off on this journey to really do in a way that I feel is very authentic for me. I can have a root cause approach to disease management, and that really excites me.
Yeah, thanks for explaining that. What an interesting journey you've had to this point. So we hear you saying that patient care, primary care, preventive care are kind of at the core of your dreams, right? If we go back kind of to the dreams. So how did you come across HELPcare and why this connection now?
Yeah, well, that was just something my husband had ran into Lee and struck up a conversation, and you know, thought, well, he mentioned my wife's a nurse practitioner, why don't you come and meet? And yeah, Lee was over and joined our family, all the chaos and my kids. I have a set of twins that are 4.5, and I have a couple older children too. And so, I'm a busy mom. And work-life balance has always been really important to me too. And I feel that healthcare is really conscientious of that too, to all their practitioners. So that's another way this fulfills a dream. But yeah, Lee and I hit it off, and when he was sharing the philosophy and the whole premise of healthcare, I just thought this is exactly what I believe in.
Yeah, it was really great getting to join them for supper. They invited me over for supper, and we just had and that's what we call it on the farm. We call it supper instead of dinner. But
Yeah.
but yeah, it was great, and I think Sarah really resonated with the approach that we're taking, and what she said about the work-life balance and the family prioritizing that. We talked with her about we can design this kind of position in a way that's going to fit with what your life phase is like in terms of what your needs are. And so we were able to have a little bit of flexibility and creativity in developing a work schedule that fit with where she was, in her life right then.
Nice to have that flexibility at this point, right?
Definitely. I mean, it's, and that's what's so key. As I love patient care and I love giving my all to patients, and I also need to give my all to my kids. And I know that when you're, locked in a clinic situation where you got to be there at 7:30 in the morning and you're not out of there until 5, and then you're doing your charts until 8 o'clock in the night, there's no room to help with the homework or get over to the school and do a birthday party thing. And, so here I feel like healthcare is mindful about that and really we're not only supporting our patients, right? We're supporting each other and the whole team. And so that's really, um, you know, yeah,
Yeah, well,
just through the
Doctor,
whole organization.
Yeah, I mean, Dr. Strobel talks a lot about how, we're wanting to restore the soul of healthcare. And part of the way that you do that is by restoring the soul of the practitioners. And if the practitioners are just feeling drained and not able to, that they don't have anything to give just because they're feeling constantly drained and they don't have the time for their regular life as well, then that's going to hinder what they're going to be able to give to the patients too. So it really is the foundation of what we have to have is really healthy relationships with our practitioners and where they feel like they're cared for as well. And so that's been a big part of what we've been trying to do.
If you were to compare working at HELPcare with your last place you worked, what is it that makes HELPcare so special, even beyond some of the things you've said already?
Well, I think one of the thing is the collaboration. Okay. So it's like a team sport, right? We all come with our unique maybe specialties or our experiences. So I have a unique experience just because some of the populations I've worked with have given me, learning opportunities. So I have a little unique insight into maybe certain types of cases or problems. And my colleague has experience with, like, let's say, the hormone specialty, for example, or heart disease or, metabolic disorder. And so they're going to bring their strengths. And the thing that makes this all work so wonderfully well is that we can reach out to each other and say, hey, share with me what you've learned. Is there something I'm missing for this particular patient, And so I can share a case and say, what do you think? Am I on the right track? Is there something that I could be doing more? And that's just amazing to me to be in a setting where we've got depth, and we can encourage one another. And there's freedom to learn. There's freedom even to make mistakes or to not know. I could say, hey, I'm just really unsure. This is new to me. Please provide some guidance. And I feel like I'm safe to do that. It's a very good collaborative environment.
Yeah.
Yeah, a year ago, right now, we had 4 practitioners, and we were grateful for that. But one of the things that we were just looking back, we had our leadership team retreat just recently, and we looked back at some of the developments of the last year. We have 8 practitioners now. So, like, doubling the number of members of the team who are actually frontline practitioners providing care just does build that breadth that Sarah was talking about. So I think it's really, really exciting for us.
And I can see how the collaboration works really great from your perspective. How does this benefit a patient, would you say?
Well, I think it's incredible. Oftentimes I'll say, in fact, today I even said, why don't it might be helpful if you scheduled an appointment with Elizabeth Heglin, who's also, who's kind of been studying and really honing in her knowledge of hormones. So, hey, that's reasonable. Elizabeth is here in Albert Lee, and that works out. And so then we can kind of sometimes share a patient, and a patient gets to benefit then from Elizabeth's knowledge, just for an example.
Well, I'll just say one other thing related to that is that there's no extra charge for the Elizabeth visit, because it's in membership. You're
Yep.
able to see both practitioners and benefit from both of their expertise without it having, there's going to be another bill for this. Generally, no. If you've got a premier membership, it's all just included.
Yep.
Very
Exactly.
nice, yeah. Yeah. So how about that first visit with a new patient? What do you try to accomplish? And I think you have 30 minutes to an hour or so to do that. What do you
Yeah.
try to accomplish in that first visit with a new patient?
Well, I really like to understand what is it that they're motivated to change? What is their agenda? Because I can have my idea of what would might be good, to do to improve their health, but I want to know what what does the patient think? Because that could be maybe very different. And so that's the main goal for the first visit is get to know where people are coming from, their history. Some people have not had a really good experience with healthcare practitioners in the past. And so I want to know, tell me about what your experience has been. What are some of the frustrations? What are you looking for? What is important for me to know about you? And that's usually like exactly how I'll phrase that. What do you want me to know about you? And we kind of go from there. And certainly, collecting the surgical history is important, the medication list is important, and all of the other prior, history taking is very important. But I really like to get a good sense of the individual, what motivates them, what they want to work on. And sometimes I'll say, what do you want to do with your membership? Because you can use as much or as little of your membership as you really want. You want to roll up your sleeves and really tackle some things, and boy, you got an opportunity to do that. And not everybody is really ready for that, to be honest, and that's okay too. And if they say, "Well, I just kind of want to, get my, check on things," and that's fine too. It's all spectrum of interest, and sometimes people can start out not really being interested or motivated, but you just listen and build trust, and then you see where things go. That motivation and interest might pick up throughout the course of the relationship. So it's a no pressure thing. I don't put any pressure, obligation. I take people as they are, no judgment. I like
Great.
it. I love meeting new people.
Yeah.
It's great.
I love that approach. And there again, you're able to do that because the appointments you're not locked into that 15-minute visit each time, right? You've got,
Exactly.
yeah, it's wonderful. Can you think of an experience you've had with a patient without divulging, of course, any names or personal information, but in the time since you started, that kind of reflects, when there was an aha moment for the patient or for you in terms of the patient experience?
I think, okay, here, this is one good example of what taking time with patients does or can do when you're not rushed. I had a patient come in. I'm just going to keep it generalized for a acute visit, a skin lesion issue. We'll say that, okay. And so what had gotten her in the door was wanting help with this particular, little sore. And what we ended up talking about was completely unrelated to the acute problem, but was actually more relevant and pertinent and did more for healing. And it was an emotional conversation. It was a spiritual conversation. Through just sharing and listening, she kind of even said it. Boy, I didn't really, this wasn't about my skin thing. I needed to be here for this. And so that happens when you create the space for those opportunities to transpire. So, yeah, those things kind of happen all the time. And my philosophy, my approach to care to healthcare, I have a very, we holistic is kind of a buzzword. It gets used a lot, but I really am. I believe we are spirit, we have a soul, and we live in a physical body. And even though healthcare, it's kind of the body is what gets us here. The problems with the aches and pains and joints and, lab work gets us in the door. But there's so much more to our wholeness and wellness that is soul and spirit that is just as important as issues in the body. And there's a lot of overlap that we really don't even fully understand how our soul, our thoughts, will, and emotions are actually manifesting and impacting our physical health. So to capture that, you have to slow down enough and you have to be tuned in enough to be able to find those little nuances. And sometimes that is what people really, really need most of all. And then, yes, we can take care of your skin concern or your, acute
Mhm.
thing. But I think that's the difference with what healthcare offers is an opportunity to address more of the needs that maybe would be glanced over or missed.
Yeah, I think I've heard stories, from the traditional healthcare system where a patient will come in and maybe even has said, I want to talk about these two things. And they've kind of had the hand put up saying, no, I'm sorry, we can only deal with one of those now. Like that's what this appointment is for this thing. And so I think the flexibility and the freedom that both our practitioners and our patients, our members have, to be able to kind of go where the conversation takes them, and what they find out through their conversation really is the more important thing for them to be dealing with at that time, is really just, I think, what sets apart this kind of care.
It's a beautiful story, Sarah, that you shared with us. And really glad that this patient had a chance to discover that. It's like a discovery both of you made together in that appointment, right?
Yeah, we both had a chuckle. It's like, well, you know, isn't that funny how that happened?
It wasn't on your bingo card. It wasn't on her bingo
No,
card.
it wasn't, but
Yeah.
Yeah,
it was good.
very good. Yeah, and I heard just I have a friend who I'm involved, I know through some other ways, who became a member of HELPcare Clinic. And he talked just in the last week or so. He said, man, I can't believe how great Sarah is as a practitioner. And in fact, he said, Sarah, I had this, speaking of skin lesion, I had this thing on my shoulder, and Sarah looked at it and said, we should actually have Dr. Strobel take a look at that. And so together, he was actually over in Rochester, but he came over to Austin to see Dr. Strobel, and just said, like, this was the most amazing healthcare experience. He said, that's the most amazing healthcare experience I've ever had. And because, like, I had this taken care of, this had been bothering me for a while, but I just hadn't gotten around to dealing with it. Through Sarah and then Dr. Strobel were able to deal with it. And he said, and then I was amazed, like, I got a phone call that night from Dr. Strobel. Like, does he ever go home? And the answer is yes, he does eventually, but he was calling to follow up and ask how he was doing. That's that aftercare, I think, is, and that continuity between visits is something that I think is really important.
Yeah, and that speaks again to the depth of the team, right? That was another example of the collaboration. It's like, let's do
Mhm.
this together with Dr. Strobel, who has just got a little bit more, right, a lot more experience in that. And it was great. It was a privilege for me to be able to learn and to do that with him together. So yeah, just great.
Well, should we be specific enough as to say, how would someone make an appointment with Sarah? They're listening to this and they say, wow, I really want to go,
Yeah.
um, I'd love for have her be my primary care
Sure.
provider. What would they do?
Oh, well, I mean, the first thing is sign up for membership. And when you choose a membership, I believe we still have the opportunity to select your practitioner as part of the registration. Otherwise, just when you call for your first appointment, ask for Sarah. And so Sarah's currently seeing patients in Albert Lee and in Rochester. And so that'd be the way to get to see her. But she is, as a newer practitioner with us, she has more capacity than someone like Dr. Strobel, who's been building up the practice over 4 years. Um, so she does have availability, and I think people who come to see her will be really glad they did. When we first talked, it was more of just an introduction to what healthcare was all about. And then I think I followed up afterwards to gauge your interest. And so what was it that put you in the position where you're able to say, hey, this is something that I really think I want to do?
Well, I think I've always had an interest in direct primary care. I like the idea of as a model, just ethically, efficiency, getting away from the current healthcare system and giving people alternatives to that, I think was really appealing. And not only that, but I think the emphasis on helping patients achieve optimal health. So it's very important to me that we're not just looking for, do you have a disease state, but is your body functioning optimally? And those are really two different approaches to have. And I think a lot of times in traditional settings, allopathic medicine approaches, it kind of looks at, let's make sure we're kind of checking the boxes and we're pretty content with that. For example, especially when it comes to like lab work and lab interpretation things, let's look at your thyroid. Oh, your TSH is good. It's normal within this wide range. It falls within that wide range. That must be good. We don't need to look at that again. We look at, a metabolic disorder. Your fasting glucose is okay. Your hemoglobin A1C might be creeping up a little bit, but you're not pre-diabetic, so we'll forget about that. Won't look at again at that. And there's just kind of this waiting until things fall apart. That's the part of the sick care model, right? It's like even insurance coverage. Well, we're not going to cover any treatments until you get bad enough. Well, to me, that just seems so backwards, right? Why would we wait for the wheels to fall off, before we do anything about it? So it's this downstream thinking in the sick care kind of where the backward incentives are just backwards. So healthcare is the antithesis to that. Healthcare is we're going to look at your health and we're going to look for optimal levels, not just are you diseased or not diseased. We're going to look at is your thyroid really functioning well? Is your are your metabolic markers indicating insulin resistance that, that foreshadows prediabetes long before we have problems with elevated blood glucose, right? So, for example, we'll do a fasting insulin. So that's much more sensitive, earlier detection, right? Than by the time it reaches a stage where we're having elevated fasted glucose. So that's just an example of the big difference between, I think, the approach to healthcare and primary care. I was a little disillusioned, honestly. I told you my story about, working in the hospital and how motivated I was to prevent people from getting to this point in their life, right? And then I went through my education training and I did all this stuff. Primary care or preventative medicine was really more like secondary prevention, not really primary prevention, because it was still catching things way too late. And it wasn't really doing anything to prevent people from coming down with metabolic disorder. So that's why I feel so good about practicing here at HELPcare, because I feel like I'm really able to take a deeper dive under the hood with people in terms of their lab work. I'm looking not just for, I'm looking for optimal levels and talking with patients about that. Yeah, I guess it's good enough, but we could make it better, And so for a certain population of patients, they're really interested in that. They don't want to just be not sick. They want to be functioning well. They want to be healthy. So, yeah, I think that was a big draw to healthcare.
Thanks for joining us. If you enjoyed this episode, be sure to leave a comment or a review and to subscribe on Spotify, Apple Podcasts, or on YouTube. And also to share Take Charge with HELPcare with your friends and on your social media channels. At HELPcare, our passion is helping people take charge of their health and their health care, helping employers take charge of their health plan expenses, and helping physicians and other practitioners take charge of their healthcare careers. Learn more about the healthcare clinic difference at healthcare.health.